Hey friends, welcome to my channel, Life with Everyday Haley. Haley here. This video is hard for me to make. I am making this right now and I probably will not post this for a while, but I wanted my deep, raw feelings in the moment of the situation and I wanted to share it with you transparently. And I appreciate everyone for tuning in to my channel, following my journey. I do believe that God has me here for a reason. And I think that he's using me to relate to others and hopefully educate. So if you find my channel and you are relating to my circumstances, my heart goes out to you and I'm really sorry. That I believe better things are ahead and I am holding on to hope for the future. So with that, let's get started. Today I have an update on my trying to conceive journey for you all. On my channel, you can look back to see previous videos of what's happened, where we've been, where we are. It's kind of a hard place to be in right now. I started trying in July of 2023, got pregnant in August of 2023, so right after we started trying. We have been tracking ovulation and all things, and so that is why I believe I got pregnant so fast. Definitely recommend that to couples that are thinking about trying. I used the pre-mom kit. Really, really good. I had a chemical pregnancy that ended in September. And it was at about 5.5 weeks when I really started bleeding and losing the pregnancy. That process was hard. I do have a video on my channel about that, my first loss. And it did take me some time because, you know, that was scary, first time for all things. But it was, not to diminish it, but it was a chemical. And so it was not a lot had developed, unfortunately, and it was a very quick thing. And so that was more like a period. And I did bleed for about 7 days and that was it. I got my cycle back 6 weeks after that. And we were encouraged to wait one cycle, you know, before trying. So by the doctor. So we did that. So we started trying again in November of 2023. And I did not get pregnant in November. I did have an HSG procedure in October. And you can view my channel for more information about how that went and why I did that, why my doctor wanted me to do that. And I didn't get pregnant in November. I was kind of sad about that, but I ended up ovulating a little bit sooner than we had thought I would that month. And so we didn't really try as much that month. And so it was just like, okay, let's accept that and let's move on. December 2023 came around and we tried very consistently before ovulation to get pregnant and it worked. I got pregnant in December of 2023 again. So we started trying in July and I was already pregnant twice before December. I was really encouraged by that. This time things were very different. I started having a ton of early pregnancy symptoms. Very early, even the first couple weeks. I missed my period, you know, and so we were really encouraged that everything was going how it should have gone. Unfortunately, I had another loss in January of 2024. It is now February 7th of 2024, and I have had just a little bit of time to process this. And again, I wanted to share my raw emotional feelings. I had several videos prepared to share with you guys of my pregnancy journey and all of the symptoms I was feeling by week. I have deleted those videos. It was too painful, honestly, for me to share those. And I really just deleted them. I can share with you now what I went through. I'm thankful for the opportunity to be pregnant. I thank God for giving me the chance to feel what it's like to be pregnant for 2 months and all the things that come with that in your first trimester, which is not easy, by the way. But I did delete those because I was like, this is too painful. I had also been tracking my pregnancy with a really cool little photo where you take like weeks of gestation, all those things and what you're feeling. I deleted those as well because it was too painful for me to keep them on my phone. But I am hopeful again for the future. And if you are in a place of loss, this is your trigger warning. This video may not be the best for you to watch, but it may help you when you're ready to watch it or if you are going through this. So here's my story. Didn't expect it, didn't want it, significantly has traumatized my life, honestly. But it is a part of this journey for a lot of women. And if you have had a successful pregnancy with no issues, I think you should just be thankful to God for that, because there is a whole other side of this that is really dark and really hard on a marriage, on a woman and her body and her emotions and all things. So let's get started. Let's not get too deep and dark. So I found out I was pregnant on December 14th. I ovulated of 2023. I ovulated on December 3rd of 2023. And so I found out about 11 DPO, and I tested because I was having a ton of early pregnancy symptoms right away. I was having nausea, weird feelings about food, not wanting to eat, nausea after eating, sore breasts. And first pregnancy I had ever felt that. And I believe it's because with my first loss, my HCG levels just did not rise like they should have. They never got above maybe 100. And in this situation, things were different. And so I tested, it was positive. I continued to do a line progression. I do have that document saved. I have started a memory box for my losses, and I did just save that line progression in that box. But if I do get pregnant again and it works and it sticks, I will share that with you guys. So a line progression is where you track your test from when you test to as far along as you want to go, to watch the line progress. I did this until I reached about 6 weeks, around the beginning of January. And so my line progression kept getting darker. It wasn't getting as dark as I thought it should based on a lot of people's tests, but it was getting darker. And because I have a history of having primary ciliary dyskinesia, it is a genetic disorder that I inherited from my parent, I knew that I was at a higher risk of having an ectopic pregnancy. I've known this from day one of trying to get pregnant. And so I contacted my doctor when I was about 5 weeks pregnant and said, hey, I'm pregnant again. What can you do for me to make sure that, can we check to make sure this is not ectopic? I have this predisposed, issue that can cause ectopic pregnancies. Can we just rule this out as soon as possible? What my doctor offered me was, the doctor I was seeing through my pregnancy, was HCG testing. So I went in about 5 weeks and 2 days, and it was about 219. So that shows you where my HCG was. Went in 2 days later at like 5.5 weeks, and it was 519. So it jumped up substantially. So they told me, hey, this is trending good. We don't have any reason to think you have an ectopic pregnancy. We think all is fine. Well, I honestly, just transparently, wish that my doctor had done more for me. You can do an ultrasound and see the tubes and everything, as early as even the baby as early as around 6 weeks or so. I wish that she had gone that additional step and done that for me. Luckily it wasn't. And so that's a huge, huge win for me as someone with PCD, that I did not have an ectopic pregnancy. I had a real uterine pregnancy. So if you found my channel and you struggle with PCD and you're wondering if you'll be infertile, or you're wondering if you will not be able to carry in your uterus and you will have ectopic pregnancies over and over, which can happen, and if you're worried about just needing IVF, I hope you see this and you feel hope. Because in that moment, even though my pregnancy, which I'll share in a minute, did not turn out for the good, I now know that I can carry a pregnancy in my uterus. And that is something that my family, my doctors, and me have wondered since I was born, literally 30 years ago. So there's a little bit of a light here. It's hard to see, it's very dim. But if you do have PCD, first of all, I got pregnant really fast, and I got pregnant in my uterus. There's, all these studies and research that shows people like us may have issues with the cilia in our fallopian tubes as we do in our respiratory tract and lungs, but that is not always the case, and I am a really good example of that. All right, so let's keep going. So had HCG tested around 5.5 weeks, and that was the last time I had my HCG tested. Everything was going great. I did not spot, I did not bleed, I did not have any, I had implantation cramping, I will say that, around like DPO 6 and 7. And that was a little weird for me, but yeah, I had cramping. And so I just thought, well, I'm having implantation cramping. That's another reason why I tested. And I progressed and everything was going great. I was having, you know, early pregnancy vomiting, nausea, smells were getting to me. I had super tender breasts. I did have occasional on and off cramping, but nothing bad, nothing worrisome. Very fatigued, tired all the time. Had to go to sleep early all the time in my first trimester. And also I had acid reflux at night, which you can treat with Pepsid, which is safe. So anyways, I was taking prenatals. I was taking my arthritis medication that's safe for pregnancy. And that was it. I wasn't taking anything else. Wasn't doing anything else, and was just happy-go-lucky in my pregnancy bubble. And I will say that that was the happiest month of my life. And I will never, ever want to trade what I had with that. It was so special. So let's move forward to when things really just shocked us all and surprised everybody. Yeah, this is hard. Let me just preface with, I had a missed miscarriage. If you're unfamiliar with what a missed miscarriage is, it is not like what I had the first time. It is where your body does not recognize that something went wrong with the baby and the baby no longer is developing. When I had my chemical loss in September, I bled naturally. Many women still have natural miscarriages even in their first trimester and just start bleeding and realize that something is wrong. For me, that is not what happened. And for your education, a missed miscarriage is really hard. I believe a natural miscarriage is also just as hard because you start bleeding and you're like, oh no, something's wrong, you know, you start cramping. A missed miscarriage is a whole nother level of mental anguish, and it is not a quick process. So let me just preface with, a missed miscarriage is not a quick thing. When I had my chemical loss, I bled for 7 days. I could still work, I could still go out. I just basically had a period. It was painful though, don't get me wrong, super painful. This was like literal hell. Like all I can say is I lived in hell. We went in for our first ultrasound at 8.5 weeks. They made me wait till 8.5 weeks. They said that you can't see much of an ultrasound before you're 8 weeks, so we don't want you to come in before then. Some women even go at 10 weeks, which is crazy. But I went in and they did a transvaginal ultrasound on me. And it was done by an ultrasound technician. And again, I've never really had this done in the purpose of being pregnant. This is my first ultrasound and everything. First of all, it snowed really bad, and so I didn't get to have my first, you know, appointment with my provider. I had to do it over telehealth, and so she couldn't really examine me or anything. But we talked, and let me back up a little bit. 4 days before this appointment, I started having some mild spotting. So, of course, spotting is scary in early pregnancy because it can signal that something is wrong. And I started spotting, and it was during a big snowstorm, so nothing was open. I did panic when I saw that because I had a loss previously with a chemical where I spotted and the next day I lost the baby, and it was all really, really fast. So I started crying, I started shaking. I got my husband, I was like, I'm spotting, something's wrong, like what's going on? And it was just very like light brown spotting, so it really wasn't even a big deal. And honestly, you can spot in pregnancy for no reason. In my situation, it was a signal that something wasn't right. So if you do start spotting, my advice is call your doctor. It could be harmless, it could be something, but not, you know, catastrophic, or you could be experiencing some weird symptoms of a miscarriage. That week was hell because I was so worried, and I was just crying saying, I don't want to go through this again. Why is this happening? I was just really confused. So I told my doctor, we had our virtual telehealth appointment, and she was like, don't panic. Your HCG was good. You're having, you know, a couple weeks ago, you're having all the pregnancy symptoms. You're not bleeding a ton. Like, don't panic. Like, this is probably maybe a subchorionic hematoma. That's probably why you're spotting. Don't worry. So I went in the next day. That was not what happened, unfortunately. Actually, I'm still kind of confused about what happened a little bit, but more to come on that. But I went in, like I said, for my ultrasound, and they were very quiet. They didn't show me the baby. They didn't show me the screen. They didn't show me the heartbeat. And my husband was just sitting there, like, he doesn't know anything about this stuff. So he was just like, he didn't know what to expect. I didn't know what to expect. They left the room. They're like, we got to talk to the doctor. And I said, oh my gosh, something's wrong. And I was just so shocked. I was like, something's wrong, you know? And he's like, we don't know anything yet. And I'm like, something's wrong. Like, I think they were supposed to show me the heartbeat. I think they were, you know, supposed to show me the baby. And like, they didn't do any of those things. And he's like, don't panic. We don't know anything yet. It's in God's hands. Whatever happens, you know, it's okay. My husband is so level-headed and calm and just so beautiful in his heart for God and his spirit that like nothing shakes him. But I was torn, you know, you can imagine how I felt. So they came back in and they were like, unfortunately, your baby is measuring at 6.5 weeks. And you're supposed to be 8.5 weeks. And I know you were meticulous on your charting with your ovulation and trying to get pregnant. And I said, yes, I was. I know how far along I'm supposed to be. And they're like, your baby doesn't have any heartbeat. And so we think that your baby stopped developing. And I can't tell you what you feel in that moment. I can't tell you how painful that is. Just to think about it. And the thought of that went through my head like repeatedly, like what she said, for days after that. That's all I would think about. And it was just like repeating in my head. And if you've been there, I'm so sorry. And I'm sorry to get emotional, but like, apparently it happens a lot. The doctor did tell me that it happens a lot. And women come in there a lot. It doesn't make it any easier, but women come in there a lot and this happens. And they don't realize it till they get there. And so they said, you know, you've been spotting a little bit. So now we think that, you know, maybe your body is starting to recognize that you did lose the pregnancy, you know, 2 weeks ago. They told me they didn't see a subchorionic hematoma at the time. On the fetus. Everything developed great. I had everything developed properly. The sac was measuring in comparison with the embryo. So everything developed really well. And so in a way that kind of gives me some peace that like there was a baby there that had been developing and everything looked great. It just, something stopped, something went wrong. And now we have to figure out what that is. So they told me like, you've got a couple options, like, you know, what we recommend you do is go home and we'll test you again next week to see if anything's developed or grown. And if so, you maybe just are earlier than you thought, but I knew in my heart that wasn't what happened. So I held it together in the office. Once we got into the parking lot, I was sobbing and my husband, you know, just held me. And it was kind of hard that week because, well, it was very hard that week. I really didn't even speak. Like the whole ride home, I was just like in a fog. Like I couldn't even like, I don't even know what happened, honestly. It's all a blur. The next few days were just a lot of, you know, shock. It was a feeling of shock and surprise because I had been feeling so good, having all the pregnancy symptoms and had no idea other than the little spotting that anything was wrong. And actually the spotting kind of stopped, like it would stop and it would start back. It wasn't consistent and it was never enough to wear any type of pad. So anyways, the week was filled with, you know, having to tell the news to my family. That was hard. They were very supportive. I do recommend you tell the people that you love around you when you've had a loss. And I hadn't told everybody that I was pregnant again because I was like afraid to lose the baby again. But looking back, like now that this has happened to me twice, I will tell my family because they are my prayer warriors, and I will tell them from day one, hey, you need to pray for me. I feel like once you've had several losses, things just kind of change and you start viewing pregnancy a little differently. Unfortunately, you kind of lose that like giddy, like gullible happiness, and you realize like there is a substantial amount that can go wrong here at any phase of the process. And I just didn't really want, like, moving forward, I have to be more cautious, and I am going to share it with my family so they can just shower me in prayer every step of the way. But they ended up telling them, they came over and were so supportive, brought me food countless times, cooked for me. For the first few days, I really didn't get off the couch. You know, I do work from home, so that was really helpful. So I could keep working at home, you know, and just kind of go at my own pace. If you start acting weird or different, I do encourage you just to share with people around you, because there's no way you're going to be the same after getting that news. So anyways, the week went on. One of the hardest weeks, not the hardest week, but one of the hardest weeks of my life. I think the hardest week was actually passing the baby. So we found out the next week that, yeah, confirmed, no heartbeat or anything. And we went in there and I just tried to like kind of shut my mind off during the ultrasound. I found it to be really triggering based on what we had done the last week. And I just kind of laid there. I also was having a ton of cramping that day. And so I kind of thought I was about to pass naturally, but I never did. They did the ultrasound and like there was some blood that came out. And so they're like, you know, you're bleeding a little bit more. Like, we feel like you're going to pass the baby soon on your own. And based on the ultrasound results, which they didn't really go into detail with me of what they found, I had to read it on the result when it came through on the app for me. But I found out about the hematoma. I found out about the shrinking, and that really hurt me. Like, I cried after I read that, because I was just like, to hear the things that were going on with my precious baby that I wanted so badly, that was disturbing. But again, I think it's your body's way of processing. And so they told me, like, you've got 3 options. You can go home and try to pass naturally. You can take the medicine, the Misoprostol. We'll go into that in a minute. Or you can do a D&C in the office without sedation, or you can do it in the hospital with anesthesia or whatever. So I had already kind of talked in my head about what I wanted to do, and I really thought I was going to pass the baby on my own. So I opted to go home and see what was going to happen. And then maybe just take the medicine if it didn't happen, because I went back and forth between medicine or D&C. And I chose the medicine because I thought, well, I'll be at home. It'll be more like the first time. I've done this before with a natural passing. That was my initial thought. I have since learned a lot since saying that. But that's kind of what the decision that we came to. So I went home truly believing that I was going to pass. It never did. I had a ton of cramping and a ton of back pain. So maybe my body would have eventually passed the baby. But it took another week, and at this point the baby had been deceased for 3 weeks, and they had told me about the risk of infection if you start having pain or other things, and I just did not want to risk that. And just walking around knowing that my baby was deceased was really hard, very humbling, very I felt embarrassed. I felt something was wrong with me. I felt like people being around me would be grossed out by that. I was kind of grossed out just knowing that. There's just a lot of emotions that go on. If you've been through this, I'm really sorry. Just walking around knowing your baby is dead, that you wanted so badly, and you thought they were alive, is just another level of hell, honestly, to goodness. It's the worst thing that I've ever been through. There we are. So another week passed, and I just was really getting anxious. I was like, you know, it was just too hard. So I contacted the doctor and said, I'd like to take the Misoprostol. Looking back on that, I am not sure that was the right decision for me. I am not going to lie to you. Still, I'm a week out from it. I actually took it a week ago today. But I am not, and maybe a few months down the line, my thoughts and feelings will change. I am not sure I made the right decision. And I am not sure I really knew what I was setting myself up for. So I share this with transparency to help you if you're in that situation and you're trying to make a hard decision. Golly gee. So they prescribed me the Misoprostol, which was 4 pills, 400 mcg of Misoprostol, and another 400 in case the first dose did not work, and then a pain medication. But the pain medication they gave me was very, very light and very, very small. We have a family member that is a pharmacist, that more to come on that, but we learned a little bit about this from them. I told my work that I was gonna be taking off a couple days, because I had done some research on this medicine and knew that I probably wouldn't feel too good. So I basically took a Thursday, Friday, and then the weekend off. Let's talk about the Misoprostol experience. At this point, I had kind of already accepted in my heart that my baby had passed. And I had 2 weeks to go through that emotional, acceptance. And I was doing a little bit better. But then when you do the Misoprostol, or you do have the DNC, whichever you choose, or if your body does pass naturally, then you have to go through the physical part, and you have to go through the my body is no longer connected to the baby is now gone. So I think that part is where I'm still kind of struggling. So the Misoprostol, here's what I did, just an example for you. First thing I did was I bought the disposable underwear from Target that you can wear in your postpartum. I bought the Target brand. It wasn't the best quality. I will say several of them actually broke when I was trying to put them on. So maybe I'll go for a more expensive brand in the future. But I did try that instead of a normal pad, and I highly recommend that. They were a lot more comforting, comfortable, and covering, and they caught everything. So please think about that. Before we got started, I had my mom come, and she was a wonderful support. My mom literally got me through that. Do not do that alone, ever. Always have somebody with you. My husband was there too, but having a female there was different and more special. So I had to insert 4 pills vaginally. That was hard. I had to like hype myself up to do this because I knew what was going to happen. We took off my white duvet because we didn't want it to get dirty. I had these old sheets that were like ripped from the washing machine anyway that week. They had just ripped. So we just kept those on the bed because I knew I was going to throw them away. We put down a towel. I had to insert vaginally, wait 30 minutes, and lay down. And I did take the pain medication at the same time. Those pills really hurt. I'm not going to lie to you. Those pills really hurt being inserted up there. Every time I tried to sit up, it hurt. Like I could feel them like around my cervix, I guess. Immediately didn't feel like the pain medication was going to help. So there's the one red flag that I have, is whatever pain medication that they gave me was not enough. Within 4 hours, I had heard that about 6 hours after taking it is when your worst contractions start. I was starting to experience contractions about 4 hours in, around the time I started bleeding. So you're supposed to start bleeding within 4 to 5 hours of taking it. And for a while I was having some pain, but I wasn't bleeding. And so we were starting to get worried that it wasn't going to work, because my body had such a hard time passing this. It didn't pass it naturally. And so thankfully I started bleeding, and I said, "Oh mom, I've started bleeding." And it was very light at first. 4 hours in, the contractions really hyped up to where it was kind of like waves. I would describe it as like coming in waves, and then it would go away. And they were about 3 minutes apart for several hours. And then about 6 hours in is when it really just, hit the fan. And my mom was like, "I'm going to go take I was feeling pretty good. And my mom was like, "I'm going to go take a shower. Are you going to be okay if I leave you down here?" And I was like, "Yeah, I'm fine, Mom." So I went and sat in the living room, was kind of talking to my husband a little bit. And then things just went down. And I started having serious contractions, back to back, no stopping, for about 30 minutes. And I was in so much pain. That was the highest level of pain I've ever been in. I remember saying, like, I'm at my pain level. Like I'm at 10. I remember I was like, I'm 10 out of 10. Like I'm at my pain tolerant. That's what I was telling them. And it got to the point where I was like screaming involuntarily in pain. I've never been that way before. And I was using some bad language, which isn't like me either, especially in front of my mom. And I was like, seriously thought I was going to pass out. At this point, the bleeding was like very minuscule. It still had not started much. And we were all like, is this normal? Like, we didn't know. And at one point they were just sitting there with me in the bedroom, just in silence, and they were both crying because I was in so much pain. Like it was a very, very emotional and, painful experience, like for everybody involved. In those moments, I will share with you when it was really bad. I'm a Christian. First thing I thought about, and I did cry, and I did say some things out loud because I think I was just processing a lot, was, God, why have you forsaken me? Because when Jesus was hanging on the cross and he was in his deep pain, that's what he said. And this is the first moment in my life where I was at that depth level of sadness and darkness and pain, where I literally said, God, why have you forsaken me? Why did you allow this to happen to me? I remember I said, I think you start bargaining when you're in a lot of pain. I said, God, all I wanted was a baby. Like, all I wanted was a baby. And this is, I think I said, this is effing cruel, that I'm having to go through this right now. And I think I like took the pillow and like punched it and shoved it over my face at one point. Just in anger. And then I also thought about God and how he sacrificed his son for us. And in that moment, I just felt death. Like, I felt death was all around me. And I just felt like, I can't believe that God did that for us. Like, I could, in this pain of losing my child, like, I had all these really, really deep feelings. And I guess that happens in moments of like deep, deep pain and deep, deep trauma. I just had all these thoughts, you know, but quickly it actually subsided, and I was able to calm back down, and I was able to get my composure, because I knew the things I was saying were not healthy for me to say. I think I was just in the midst of trauma. And then all of a sudden I started bleeding as quickly as the pain left, to the point where I had to sit on the toilet. I would rush to the toilet and it would just be gushes of blood, like somebody poured out a water bottle. And that went on for about 2 hours. And it was on and off, on and off. And I soaked up 3 of those disposable pads, those disposable underwears, in that night. 3 of them in like the span of like 4 or 5 hours. And it just kept coming and kept coming and kept coming. And then I started passing blood clots. TMI, but I started passing blood clots. And I couldn't really look because it was so much blood that it was just really messing with me. And I mean, I would wipe and it would just be like so much blood. And my mom was checking for me. In this circumstance, you do kind of want to make sure that you make sure it all passes, you know, if you can. I will say the doctor had prepared me for whatever I was going to pass. It would kind of disintegrate and you would just see kind of tissue and things. That is not what happened to me, guys. And so I share this just to prepare you that that may not be what happens to you. I think my body actually processed it more like labor than anything, because everything came out very intact. I had one big gush and it felt different, and I could feel my cervix kind of was in pain for a second, maybe when it was passing, and I knew it was something bigger. And sure enough, I had passed the baby in the sack, and all things included. It wasn't scary. It was beautiful to see what my body had created, but it was a very special moment of, wow, I didn't realize I was going to get to have this goodbye. If you're scared, I think one of the biggest fear factors I had through this was what I was going to see, what I was going to pass, what was going to come out, and there was nothing scary about it. It was actually really peaceful. And I thank God for that opportunity to see that. And everybody processes this differently. Some people may not want to see their baby, but I was able to see what I created. And honestly, seeing that gave me hope for the future and gave me some hope to try again and to have a true baby. After that, after I passed the baby, things were better. I still had a lot of contractions, but no more intense bleed, like gushings of blood. I did pass the umbilical cord about 30 minutes later, and that was weird, and it was very long, and it was definitely something different. I'm thankful I passed everything first, because I don't think I would have been able to sleep if I'd still been bleeding so severely. And I was able to go to sleep. I did have pain throughout the night, so it wasn't an easy night. Continued to pass like some clotting and some bleeding for the next 2 days, but it was nothing that bad. Compared to the first day. So the first day of taking Misoprostol, if it works correctly, you should pass most everything within about 12 hours. So I did not end up having to take the second dose because my body did what it was supposed to do. I bled for another 7 days. but my body was in a ton of pain. Like, I took the pain medication for the entire time that they prescribed it to me because I was having so many contractions lingering and just like a lot of soreness. I think it took me to like Tuesday to really start feeling better. So Wednesday, Thursday, Friday, about 5 days. Just prepare yourself if you have to go through this. Try not to work and try to just be able to lay down and rest for several days. So I am now 7 days out, and I do have some PTSD issues from the process of passing it the way that I had to. If I could go back, I may have done the D&C because they can do like testing on the fetus as well as you're asleep and you're not, you know, aware of what's going on. This was just really psychologically traumatic for me. I am in therapy. I do see a therapist, which I've shared on previous videos, and she's been substantially helpful. I actually just left my therapy appointment today, and just talking with her was really good. So I have to pick up the pieces of recovering emotionally and physically now. My husband is processing it differently than I am because he did not feel the physical aspects of what I did. He is kind of struggling to understand what I'm going through. But he is trying to support me, and I love him, and he is my rock, and we're in this together. It does feel so wonderful to have a partner that's in this with you. My family prays for me every day. They text me every day. I'm so glad I opened up to them because it's so helpful to have that support, and now they're all praying for me, and they know the struggle that I'm in. And I have people that have just really shown me how much they love me. And I can't tell you what that means when you're going through a tragedy like this. I don't think I'll ever forget how certain people have treated me, and the things people have done for me, friends and family. And it really shows you who you can count on. But for me, the hardest part has been, you know, the physical acceptance, and then the emotional acceptance, and then the physical pain that came, and then having to deal with that. If I could go back, I think for me as a person, I have struggled with PTSD in the past, and I have struggled with some things that have happened in my life, to where I've been in therapy for a long time, and so I already had PTSD issues, and so I wish I could have chosen to do the D&C where I would be asleep, but you know what, you learn, and I am really proud of my body for processing that and going into labor and contractions and doing what it's supposed to do. And it taught me that this body is tough, and this body is not going to give up, and I'm proud of myself. Anybody that went through this should be immensely proud of what they did, because you have to make yourself past your baby that you love, that you wanted so badly, that is deceased. Just to give you an update, so it's been a week, and so you can see now I'm able to drive, I'm able to get ready, I'm able to keep going. I have had a hard time getting out of bed, you know, the past several weeks since this has been going on, but in the morning I pray. Sometimes I listen to music. I force myself to get up. Taking a shower helps. Getting dressed helps. And something I've been doing that a friend recommended to me is go for walks. And I go for a walk every day. It's beautiful now. The weather's been great, and I've been taking advantage of it, going for a walk, listening to meditating worship music, and allowing my body to just cry and do what it needs to do. They're going through immense grief. You just have to cry and be okay with crying, and let your body process that grief cycle in the way that it needs to. I have a video on my channel of the grief cycle and what it means when going through early pregnancy loss. And that was after my chemical. I should probably do another one after a further along miscarriage, because it has been a different grief cycle even for this than the first one. Experiencing more emotions and feelings and different ones than the first one. I just want to share one thing. It's so hard to have hope for the future when you get to a point of recurrent miscarriage, and you just, all your hopes and dreams that you have are there, but they feel so far away from you, and you feel like you've lost them. And I think that's a part of grief, and I'm hoping that my perspective will change the further I get away from this situation. But I'm asking for God to give me hope. I'm asking for God to give me peace and understanding, and maybe a sign that things will be okay. But if you're where I am, I'm really sorry. I think the hardest part is like feeling like, oh gosh, I can get pregnant, but why am I losing my babies? And every loss is substantial. This really helped me in my grief processing. We did do a memorial service for our baby, my husband and I, and it was on a beautiful day. So a couple days after I had passed the baby, we just wanted to give that closure. We had a little heart box with a photo of us where I wrote, "Mommy and Daddy loves you." I wrote a letter to my baby and read it to my baby. I had included some scriptures that encouraged me. We had a little thing of baby's breath in there, just a little flower and a little heart. And we wrapped it in a baby blanket and we have said goodbye. And for me, that was so special. Just to have that closure. That's really helped me in this week, feeling like empty in my body. I'm not being pregnant anymore. Losing those symptoms is really hard, and just having those hormones go back down is just something I don't wish upon anyone. All of us in this situation just wish that we were still pregnant. But unfortunately, that's out of our control. If you're me, my heart breaks for you. This is my miscarriage story. But just know that this is not where it ends. I still have hope in the fact that I can get pregnant naturally and easily. And I have hope that a fertility specialist will be able to help me find the next steps, how we can treat this and hopefully prevent it. It's hard for me to look to the future right now, but there are other ways to be a mom and to have a family if this one doesn't work out, if this way, the natural way. And I'm asking for God to give me clarity, acceptance, and peace about that. So I'm praying for you. If you see my video, I hope you didn't enjoy it, but related to it, and would love to hear from you below. There are Facebook groups I've joined for recurrent miscarriage, pregnancy loss, and different things that have really encouraged me this week. So if you are in my boat, try to find one of those on Facebook. I've connected with several women in actually the same situation as me right now that have really helped me and encouraged me and just been a friend like no other, just to talk to each other. There are so many resources out there. Connect with people. I've connected with friends that have gone through this recently. I actually know somebody that had the exact same situation happen, so she's been a huge help. And lean on those people that you really feel like understand. And there's so much power in that. And my friendships with those people have grown substantially over the past week because we relate and we're like so deep with each other and encouraging each other. I believe God has a plan. I believe I'm meant to be a mom, and I will be patient and accept His plan and wait for that to happen. Thank you for watching this video. Please tune into my next video for all of the research I've done on my fertility, my body, my next steps with fertility help. And I hope it brings you closure and helps you find peace and answers in your situation. Thank you for watching. Have a great day.